Good morning, everyone. My name is Zenobia Harris. I am the CEO for the Kent Chamber of Commerce. On behalf of myself, the board of directors, our staff here, we'd like to welcome you to our luncheon for November. Today, we are discussing with Chief Morris with Puget Sound Fire Authority. Before we get into the presentation, I do want to recognize that this luncheon is sponsored by UMA, and we do have a commercial sponsor by TacuSign as well. Just so you know, again, this is live on Facebook via our media sponsor. If we can go to that slide, our media sponsor for today is I Love Kent. I Love Kent has a variety of different outlets that you can take a look at, but specifically anything that you need to go on that's here in the city of Kent, you can find it on I Love Kent on their Facebook page. So now we're going to do a few introductions for the day. I'm just going to briefly look at this slide and you can go. So Scott is going to set everyone up with the opportunity to share your screen or at least be able to speak. We're going to do the 1 minute or so introductions for all of our guests on the line today. We'll start with your name, your organization, what product or service you provide, the perfect client for you, and we'd like to share here on this call if you have a member-to-member discount promotion going on so that we can make sure that we're promoting that. Seeing as those Shop Small Saturday is coming up at the end of this month, we want to make sure that we're getting all of the information out. Okay, so if you do not have a camera or a microphone, you're welcome to type it into the chat and I would be more than happy to introduce you. So we are going to go by my screen, who I see on the screen. And we will start with Ethan McElderry.
Can you hear me?
We can.
How's it going? Yeah, so my name's Ethan McElderry. I am with the Weatherly Inn at Lake Meridian. We are a memory care facility. We have a location in Tacoma as well, and then we have one in Renton coming up. Hopefully that will be done in about a year or so. And our perfect client is just anyone who is in need of memory care. And we do not have a member-to-member discount promotion going on at the moment.
Okay, thank you for sharing. Welcome aboard. I know we were working with Susan before, I believe, with Weatherly Inn, so we are happy to work with you moving forward. Now have Jonah.
Hello, it's Jonah here. I'm here with Carrie, where we represent UMA. What we do is provide you with phone service that will be able to work for you anywhere for your commercial business, especially in this work from home climate we have. Whether you are working at home or your brick and mortar office, we can make sure that all of your phone calls are getting to you, no matter where you are, whether that be on your smartphone, whether that be on the phone that you pull out of your office and bring home and plug in at home. It'll work the exact same way. So that's what we're able to do with all of our customers here in the local area, and we'd be happy to help you. We have a special, like always. We're always month to month, so we're completely flexible.
Wonderful, thank you. I know you guys have a presentation later on today.
Yep.
Thank you so much for being our sponsor for the day. We now have Lily.
Hi, my name is Lily Tran. I'm an enrolled agent and the founder of TacuSign. I own a virtual tax firm. We serve individual and small business clients across the United States. The perfect client for me is any client who's going through a life-changing event. So maybe they started a business, they just had a baby, they started a new job, they're retiring, they just got married, because I provide bookkeeping, taxes, and representation. Okay, and then member discount. I am offering $50 off virtual bookkeeping and tax coaching sessions. So you just type in new client, all capitalized, into the book online when you book online.
Wonderful, and we'll be sharing that information, how to find you online. Next on the line is Sarah McNeish. I will go ahead and introduce Sarah. Sarah is with Multi-Service Center, which is a nonprofit working through South King County to provide pathways out of poverty. I'm sure they're always looking for partners to assist in that pathway and widening that. So if you have any information, they can be found on our directory if you want more information on MSC. Thank you, Sarah. So next we have newly elected representative, Tina Orwell on the line. Tina?
Hello, thank you. It's great to be here. Tina Orwell, I have the honor of representing the 33rd Legislative District. Thank you.
Wonderful, thank you. Jennifer?
Hi, Jennifer Gellner here with Gellner Law Group, and I do estate planning, probate, trusts, and tax controversy. And there's a lot of perfect clients out there for me. I don't have a promotion going on at this time.
No problem, thank you so much. We have Tom Renner.
Hey, good morning, everybody. Thank you. Again, my name is Tom Renner, and I represent Holmes Electric, and I am their safety trainer and business coordinator for business development. Our organization is a power and data source, so if you need any kind of power from low voltage to high voltage, we can handle it for you. We will support all your power and data needs, and so really that's our perfect client, everybody. We all need power, and especially today in data. And unfortunately for you folks, we do not have any special discounts going on right now. Thank you.
No problem, thank you. We have Tom.
Hi, Tom Faggy with Merid Consulting. We are a customer and employee experience improvement consulting firm. And what we do is we help clients understand how customers are viewing their experiences with our clients. And we go through a specific process to help them with that. There is no more perfect client than another. Businesses of all kinds can actually benefit from this, from retail to technology to distribution. We do have a member-to-member discount right now, a free customer experience assessment, and a free workshop.
Wonderful, thank you. Not here to promote, but Tom did something for the chamber, and the whole time he was giving us the results, Array and our eyes were going, oh my gosh. I mean, he really drilled down and gave us some customer experience today. As you can tell, if you were at our luncheon last month, it was a little different. And how we're doing it today is based on some of the survey information we received from Tom and his company. So highly recommend all chamber members, but we have recently used his services. Next on my screen is Rosa. Rosa is with Champion Arms. They are an indoor shooting range. They'll be having specials for Thanksgiving Day, Black Friday, and Saturday. Small Business Saturday, and they'll be posting all of their specials on their Facebook, Instagram, and their website. So again, that's Rosa, who is also a board member for the chamber. Rosa, thank you for your service, and with Champion Arms here in Kent. All righty, so next we have Vine Maple Place. We have Maida with Vine Maple Place, and she's trying to get her sound on, so we'll give her some time so she can introduce. I know Vine Maple Place is doing some wonderful things there. Next on my list is Sarah O'Connor.
My name is Sarah O'Connor. I am currently an account manager for Multicare Occupational Medicine. We provide workers' compensation and other employer-paid services in the King County, Pierce County, Thurston County, and Spokane areas. And our perfect client is someone who wants to partner for the best outcome for not only safety reasons, but their employee health at their organization. And I don't believe, we don't have any member-to-member discounts currently going on.
Wonderful, thank you. And then last but not least, we will highlight and give the phone over to Scott Schaefer for his introduction.
This is Scott Schaefer with South King Media. We run a network of 7 hyperlocal news websites, including I Love Kent. And we're pretty active members in the Kent Chamber, and we appreciate all the Chamber does. Thank you.
Thank you, we appreciate you.
Good morning. Today you might say, what is UMA? A lot of people haven't heard of us. We have been in business since 2004. We were born in the cloud, and so we do voice over IP management for your business lines, as well as have backup continuity and independent internet for you. We are 1 million core users, 2 million plus total users. Consistent growth over the last few years have been 49.8% in the B2B growth, and over the last 5 quarters, we have added 800 plus employees and contractors. PC Magazine Readers has rated us again this year, 7 years in a row, as the #1 voice over IP provider. We are giving more clarity and measuring your connections, keeping you connected, and having that ability to take that phone anywhere you need it.
One thing you might notice too on this slide is that it's PC Mag award is based on users, not based on somebody that's paying for this kind of advertising. So PC Mag does not get any money for us, and so you'll see the rankings that the incumbents that we have in the area. You might not even see them on here, but we are on the top. And this, of course, is for a nationwide situation. So we do see some of the local incumbents a little bit further down, and one that's not even on the board, but we won't say any names because you know who they are.
We have 2 plans for our users. One of them is called Office, and as you can see, it has several on the buffet list that we don't charge you any extra for. It comes with your plan. The Ooma Pro, we add additional call recording for those of you that are selling something over the internet. You want to record that call. We have enhanced call blocking, voicemail, transcription, which those of us that are really busy and on the phone often, it's really nice to see that typed out message where you can just read it and decide whether you need to interrupt anything for that meeting to go and call them. We have a desktop app for those of you that are trying to track everything and you want to track what you're doing during the day. It's highly efficient and it's amazing to use. It's just one click away. Higher usage limits for extensions and monitors, call parking, auto conferencing, and much, much more. So one is $19.95 and one is $24.95.
And of course, it's free calling in all of the US, Canada, and Mexico. So all of North America is free calling, no matter where it is. And of course, you can port your phone number over from your current vendor over to us, whether it's a landline or a cell phone. We can take care of all those phone numbers.
Also, recently I moved someone over in their travel agency and they were so excited because they had to have a fax machine no matter what. And it saved them money by having an e-fax for their business as well.
E-fax is free.
Yeah, it's included. Yeah. Our Business Connect is, like I said a minute ago, business continuity. For those of you, that's a big word to say that we're going to back up your internet, that on these Zoom calls, sometimes they fluctuate and they disconnect or you have low coverage. That actually stabilizes that coverage for you so you have consistent call control and internet control. Our call control for voice is unlimited with our plans. And then we have LTE network, for you to take anywhere you want to go. If you have an RV, if you have a business where you're traveling and doing shows, when that comes back into play, you'll have that portable internet. You can unplug and plug it in somewhere else and get that coverage.
It's also been very, very helpful in the homeschool environment that we find ourselves in. We have some customers that will have their work pay for it, and that way they just do their own Zoom calls away from their current network that's in their home. And that way, too, it's a complete business write-off because it's just for their work, and work will actually pay for that bill. So we can provide you with a connect that will be separate from your network, so will not affect your kids that are homeschooling. That way, it will also let you do all of your Zoom calls without having so much feedback and sometimes some bad bandwidth. So that is part of our Ooma Connect, another option that is here to go along with what you already have for your home internet connection and as well as your commercial internet connection. That was it for us. So we'll go back to you.
Wonderful. Thank you. And just real quickly, if we have anyone that has questions, how can they connect with you, Jonah?
They can just email me at jonah.hartfield@ooma.com.
Perfect. And we're happy that you're going to put that in the chat.
Yep, I'll put it in the chat, and we'll also put our phone number in the chat too as well. And you can text.
Sounds good. Thank you so much.
Thank you.
All right. Well, thank you so much for Ooma, who is a new chamber member. They joined probably about a year ago, and they've had some really great promotions and some great information, and especially during COVID-19 have been able to help a lot of people transition out of a standard office into more of an online setting. So without further ado, we'll go ahead and pull up that PowerPoint again, and I will go ahead and introduce our speaker, the reason we are all here today. We have Fire Chief Morris, and he is going to be giving some updates and some really great information for us. And just a little bit about our speaker today. He is a graduate of the National Fire Academy Executive Fire Officer Program. Chief Morris has completed his MBA. He is also a member of the International Association of Fire Chiefs. He began his career as a reserve firefighter, EMT, in 1990 for the city of Boulder City, Nevada. He was then hired by the city of Henderson, Nevada as a firefighter paramedic, where he spent the next 22 years. He rose through the ranks of captain, battalion chief, and deputy chief before being promoted to fire chief. So without further ado, Fire Chief Morris.
Good afternoon, everybody. I appreciate that. When you read that bio and it dates back to 1990, it does not make me feel like a very young person. It's hard to believe that here I am in my 31st year in the fire service, and I appreciate the opportunity to meet with everybody today and just kind of share just some updates about the region and the Puget Sound Regional Fire Authority and the areas that we serve and things like that. And so I do have a short PowerPoint that I will share with everyone once I find it. Here we go. So we'll start with this. I hope. So what I'd like to do today is just give a brief overview of the organization. Then we'll talk about obviously the latest and greatest challenge that we face this year with our pandemic and the COVID-19 challenges. And then we'll kind of talk a little bit about the funding mechanisms for the Regional Fire Authority. And then we'll wrap it up and take some questions. So we'll go ahead and jump in and get started. So the vision of the Puget Sound Regional Fire Authority is really just all about trust. We talk a lot about our outcome measurements. And the one outcome that we're always focused on is just building trust in the community. The healthy and safe community is what we all desire as business owners and as residents. And the fire department is just one of the people or one of the organizations that helps make that happen. And the only way we accomplish that is through trust. And we earn people's trust, simply by just doing what we say and saying what we do and being a transparent and efficient organization. So we talk a lot about our values and integrity, innovation, inclusion, and service. And the vision that we try to cast is about being a values-based organization that's just focused on simply taking care of people, right? And trying to be professional and compassionate in everything that we do and meet the needs that the community has for us. And I think this year is a great example about a switching and changing need in the fire services. I can honestly share with all of you that I never anticipated being the fire chief of an organization that's facing a pandemic like the COVID-19. And the needs in the community as a result of that. But we're doing everything we can for that. We'll talk a little bit about that in a second. So let's see, our strategic goals, we're always focused on meeting the community's needs for service, and that's really about our core services. Our core services are, of course, fire suppression, EMS, hazardous material response, and then technical rescue. And then in addition, our most recent core service is our CARES program, which is our non-emergency social-based program to reach some of our underutilized or underserviced areas of the community and try to provide the correct services for folks that are in need. The next one is connecting with the community. That's really about the trust and the relationships, and having an opportunity like today is to sit with all of you. And I wish we were doing it in person, and I wish we were actually having lunch together. But this will have to work for now, and just trying to connect and understand each other so that way we're able to make sure that we're meeting your expectations as an organization. So developing organizational sustainability and resiliency. We'll talk a little bit about that as we talk about our funding. I will talk about the fact that we are one of 3 organizations in the state of Washington and only one of 268 in the country that is nationally accredited in the fire service. And so we're very proud of that, and it speaks to the quality of our organization. And then the last is the promoting the wellness and health and wellness and professional growth of our employees. We recognize that in order for us to provide compassionate professional care to folks in the community, we need to keep our folks healthy and safe, which is a challenge in today's world. But we're focused on things like cancer prevention. The cancer rates within firefighters are more than twice the national average for most cancers. and as well as just the mental health and mental wellness of our employees and keeping them healthy. So those are our focused goals that we try to lean into at all times. So let's talk a little bit about our organization. As I mentioned, we're nationally accredited. We're very proud of that. We serve a little over 260,000 people in population of residents, cover 109 square miles. We serve the community of the cities of SeaTac, Kent, Covington, Maple Valley, and Fire District 43, unincorporated, and then unincorporated district Fire District 37 as well. That makes us the second largest fire department in King County behind the city of Seattle. We provide those services I mentioned out of 13 fire stations that are broken up into battalions, so groups of fire stations, of which we have 3. We have 11 engine companies. Actually, I should say we have 13 engine companies and 2 ladder companies. And we actually have 2 additional aid units, which are 2-person rigs that provide medical response as well as fire response. And the CARES unit I mentioned. We currently have 58 firefighters on duty a day staffing those fire stations, which is then broken up over 4 different shifts. And so we have 4 different shifts of 58 people on duty at every given time. And this year we anticipate to provide emergency response and or non-emergency response to over 30,000 calls for service. So we're a big organization and we're fairly busy. So let's talk a little bit about where those calls happen. So we have the 3 battalions. The West Battalion is the city of SeaTac and a little bit of the West Hill of the city of Kent. The Central Battalion is basically city of Kent. And then the East Battalion is Covington and Maple Valley. Well, you can see that the Central Battalion, the city of Kent, which is the greatest population center in our jurisdiction, is the busiest area. Our fire station that is down in the valley on Crow Street down near downtown, that's the busiest fire station in the district. It will handle over 6,000 calls for service this year. So just to give you an idea that where the calls for service are originating. So what are the types of calls that we manage? About 75% of our calls are EMS or medical in nature. The remaining of those are calls for other types of calls for service, with actual structure fires being about 3 or 4% of our total call volume. While that's the lowest call volume, it is also the highest risk activity we do. So the least frequent event or incident or service we provide is the most critical or the most dangerous. So which is a unique aspect when you consider any type of organization or business, that the thing that you do the least is your highest risk activity. So what else do we do besides those 5 services? We provide emergency management services, which has been used really extensively this year as a result of the COVID-19. Our emergency management community preparedness piece that we provide to different jurisdictions is, several people are in that division, and it has been proven to be very beneficial in managing just the resources and the allocations and the funding pieces as a result of the pandemic. Public education, of course, which is about reducing risk in our communities. That's been a challenge this year with not being able to do in-person events or fire station tours, or the schools not being in person. So trying to accomplish public education virtually is a new direction for the industry for sure. So public information, of course, community health services and risk reduction services. So the risk reduction services is really about fire prevention, inspections, development services, plans checking, urban planning, things like that we provide to the different jurisdictions. When a developer comes into the city of any one of the cities and wants to build an apartment complex, one of the conversations we have is, what's that risk going to do to the city and how will we provide services to it? And so that has to be part of the conversation with those communities. And usually that's a great conversation with the developers. And then the last piece is this community health services. And that's really about this year about COVID. In the past, it's been focused on the homeless crisis. It's been focused on the opiate overdose crisis. Community health services is about regional partnerships with all of our different agencies, our hospital systems, our King County Public Health, about trying to come up with non-traditional, atypical solutions to the needs in the community. Responding fire engines and ambulances with lights and sirens to some of these things is not the right answer. And we're trying to get our folks the right answer. You know, when we run to those types of calls and then we have the only solution we have is to take them to the emergency room, that's not helping anyone. And so connecting those people to the right answer, whether it be social services or in-home medicals, treatments, things like that, is what that CARES program is really about, that exists within the community health services. All right, so I feel like I'm going really fast. So if I'm talking really fast, I apologize. COVID. So the COVID pandemic hit our region. Obviously, I think all of us know that the Northwest Seattle area was what started what we thought was ground zero in the country, but it turned out to not be. It was just the first recognized outbreak that occurred up in Kirkland, that occurred in a convalescent center or a care facility, which turned out to be the highest danger area or risk area for folks in those types of places. That began at the end of February, the last weekend of February, first weekend of March. And I think everybody probably is more than aware of everything we've gone through since then. In the first days of the pandemic, the greatest concern from the fire department's perspective was going to be to keep our folks healthy and protected and safe from the infected folks in the community. And when we would respond to emergencies, how do we keep our people safe? And that was all about personal protective equipment and the masks and the gloves and the gowns. Here we are, fast forward to now. What we're recognizing is that personal protective equipment is more than effective, and we have to date not had a single employee be exposed or contract COVID as a result of their duties as a firefighter or first responder. So that really speaks to our policies, our approach, and the personal protective equipment. Now, that's not saying that we haven't had employees develop COVID or be exposed. What that means is that as a part of the normal response and normal services, the risk has not materialized, which is what we wanted. It's been well managed. The risk to our employees has emerged to be from ourselves, right? It's the employee who unknowingly brings COVID with them to work because they're asymptomatic, they don't know they're positive, and they at some point later test positive because they become symptomatic or something like that. And then we have to contact trace that, which results in the quarantining of our employees and the testing of them. And so we currently have 20 employees today in quarantine. Some of those are first responders, some of those are support staff. And so we're trying to manage, how do we manage the off-duty or away from work activities and behaviors of our employees and them unknowingly bringing that risk into the workplace. Because at the end of the day, we can't afford to have our firefighters become infected or quarantined to the point that we're not able to provide services. I think we have that well under control, and I think that our employees recognize the risk, and their behaviors are more than appropriate off duty. But that's the reality of the world we're living in today. And so when I talk about an evolution of our services, one of the things that the Puget Sound Regional Fire Authority has been involved with and is leading with is the COVID testing sites. We currently have and operate 3 COVID testing sites in South King County. One of those is in Auburn, one in Federal Way, and then there's one up in Tukwila. Now you might be thinking to yourself, but those are none of the communities that the Puget Sound Regional Fire Authority provides services to. Well, it's a regional effort, first of all. It's the right thing to do in our community for obvious reasons. Those testing sites were late to get open in the South King area. I felt like the King County Public Health was struggling, obviously, and overwhelmed by the pandemic. And so we partnered with King County Public Health and just simply provided some expertise and some manpower to get these testing sites open. And so they're up and they're running. And what we are seeing is that the COVID positivity rate in South King County is the highest in the state. At one time, Yakima was higher, although that has improved. As of the end of October, the city of Kent's positivity was about 12 or 13% of the testing positive, those being tested. The city of SeaTac was nearly 16%. And so the transmission rates within South King County are pretty significant and concerning. And especially as we hit the fall season and the winter, where the resurgence of COVID is obviously, I think we're probably all well aware of. So the RFA, the fire authority, we're involved, and we're partnering with the COVID testing. I believe that these COVID testing sites that we've established after the first of the year, and hopefully soon, will become our immunization centers, right? That will be the lines that people will be able to get into to receive the vaccine. So let's shift gears a little bit and talk about the RFA, our funding, and our budget. We are funded basically and primarily through a two-part funding system. One of those is property tax, and the other is a fire benefit charge. I think property tax is based on the assessed value of the property, whether it be residential or commercial. We collect at the maximum $1 per thousand of assessed value. And then that, of course, erodes over time with the property tax cap limited at 1%. And so every so many years, we have to go out for a reset of that tax rate back to $1, which the community just supported for us 2 years ago. So we are collecting at basically the dollar per thousand going into 21. The fire benefit charge is a charge that by the adoption of the RFA by the voters allows us to assess an additional charge based on the type of building, occupancy, square footage, the fire flow required, the staffing required to provide fire suppression. And that all comes out of our accreditation process and a document called our standard of cover. We have drilled it all the way down to whatever type of emergency you have. We drilled it down to how many people are necessary to manage or mitigate that incident. And that really drives this additional fire benefit charge. And that creates the two-part funding system. Now, we do also fund our organization. I'll show you the next slide. A big piece of our organization is funded through interlocal agreements, grants, funds, EMS levies, and things like that. And so our total budget going into 21 is basically $83 million, of which we collect 33% of that, or 27 and change, in property tax. We collect in the interlocal agreements and EMS levies about 38%. And those interlocal agreements are contracts for services that we have with Fire District 43, the City of Maple Valley, as well as City of SeaTac. They contract with the RFA to provide services. And so those ILAs are basically just direct costs pass-throughs. And so they pay for their services. And then the last piece is that fire benefit charge, which we are by legislation limited to, it cannot grow to be more than 60% of your operating budget. And it's currently at just shy of 30%. And so we are well balanced and in good shape financially. So that's our revenue. What do we spend it on? Well, like most businesses, and most of you, I'm sure, can relate, we spend most of our money on our labor costs. Goods and services, which of course is all the stuff that we need to provide services, from fuel to fire hose to software licenses. Intergovernment fees are the $2.3 million in that. That's what we pay for things like Valleycom, our dispatch center, to provide services to us to dispatch our calls. In addition, there's funding in that for our election or our election costs when we have to run levies and things like that. Running an election is very expensive. And then the last piece of that is capital. We have about $5.2 million set aside for capital. We have a 20-year capital plan that is a refresh for all of our apparatus. We replace all of our frontline engines every 10 years, 8 to 10 years, and then our ladder trucks are about 10 to 12 years. A brand new fire engine, fully equipped, is just shy of $1 million. And so it's about $100,000 a year to purchase a new fire engine. So that's the gist of the organization. That's the basic overview. I will share that the challenges of the COVID pandemic, of course, I think are well mitigated and managed at this point. That first 90 days were extremely busy and crazy and trying to figure out what we were dealing with. We continue to face the reality of a reducing revenue source in property tax and things like that as a result of employment rates and people's ability to pay their taxes. And so that's a threat to the organization, of course, as well. we continue to seek opportunities to reduce our expenses. In the last 18 months, we received a little over $2 million in grant funding for personnel as well as equipment. And then I think most of you are aware of the wildfire risk. Here, let me do this. I'll stop sharing. How about that? Most of you are aware of the wildfire risk in the state of Washington, and we are recognizing that emerging risk into Western Washington, which is new for all of us, right? And we saw the brush fire activity that we had this summer and the reality that that's a real threat for us. And so we are focused on that. We received a grant to purchase a new brush rig, which will put 3 brush rigs in service. They're not staffed, they're cross-staffed with our engine companies for efficiency, but we'll have 3 brush rigs in the zone in our area, and that we can spread across and have quick access and quick response to brush fires in the summer. And we're partnering with the Department of Natural Resources and Hillary Franz, who was the director of that, on how we best support that on a state response level. So that's the overview of the organization. I'm more than happy to take questions or any ideas or thoughts or anything that you would like to hear about that I might be able to answer. More than happy to do so.
Yeah, wonderful. Thank you so much, Chief Morris. So it looks like we do have some questions that have come in through the chat and probably also live on Facebook. But first of all, congratulations to you and your organization for the great work that you're doing and keeping your employees safe. I thought that was really great information. I did want to make a clarification, and maybe I was wrong. You mentioned the CARES program. Should we not confuse that with the CARES Act? That is something that you were doing before. Can you talk a little bit about that just to clarify?
Sure. Our CARES program is just FD Cares, and that was the name of that we've had for the last 6 years, the program. And that was just the intent in that program was to be an alternative response service to the calls and low acuity, non-emergent type of calls that we received, that we recognize the right response and the right answer to those types of calls do not involve emergency response or transports to the emergency room. But that means that does not mean that those people in our community don't need help, or they don't need assistance getting the right kind of help. And so that CARES unit is staffed with a nurse, which is an atypical thing, right? You don't see many nurses in the fire department, but we have nurses involved because they have a holistic view of the healthcare system, and they have the ability to understand the long term and how to connect somebody to the right types of services. In the program, we also have social workers involved, and those social workers interview and work with these underserved folks in our community and try to come up with solutions that they need rather than a trip to the emergency room. So that's the CARES program. Now, the CARES Act, of course, is the federal legislation that is a relief act as a result of the COVID pandemic. Now, an interesting fact to that is the Regional Fire Authority is not eligible for any CARES Act funding or reimbursements through the federal government because we are not seen as a municipality, a city, or county government. Right? We're a junior taxing authority, an independent taxing authority, but we were not identified in that initial legislation. And we're hopeful that. Well, we're hopeful, first of all, that the legislation can expire on December 31st and we don't need any more of the federal assistance for COVID. If we do, and further federal legislation's passed, that the RFAs and fire districts are identified in that.
Thank you. I appreciate that update. I think when we met, maybe that was last year, I don't know, and you were talking about that program, I was under the assumption that you guys are just going out and putting out fires, but you talked about the response and sending out nurses and sending out the social workers. And I think that's important, especially for this climate, as folks are worried about, mental health and how are those people being treated. But it sounds like Puget Sound Fire Authority has a pulse on that. And so I'm sure the community appreciates that work. Some of the questions now from the chat is, how does the fire department, let me see. Oh, wow. Okay. Interesting questions.
Well, yeah.
Who investigates arson?
Sure.
That is a question in the pop.
Yeah, we have fire investigators on staff. We do, and all of our fires are investigated at least to the level of cause and origin to determine what caused the fire and where it originated. If in that process it determines that there's any kind of suspicious activity associated with that, that may or may not take us down the path of arson. We do have commissioned fire investigators that do arson investigation. If it becomes a criminal prosecution, then we partner with the police department having jurisdiction in the area, whether it be King County Sheriff or Kent PD. And we partner with them and work it through the law enforcement side of that at that point. And so how many fires are arson? Very few. I mean, very few are true prosecutable arsons that are as the result of significant damage or injury or anything like that. And so almost nearly every fire is accidental in nature. Last year we responded to nearly 500 working fires last year of some level, whether it's just a single engine car fire to a multi-engine apartment fire. And I think in the city of Kent, there was 21 of those were arsons. So very few, fortunately, right? So, yeah.
Wonderful. All right. So do you know why COVID-19 infections are higher in South King County? Can you speak to that?
Well, there's a lot of, conjecture and there's a lot of opinion, right? I think part of it is because, first of all, the South King County was really late to the game in getting testing. Testing was occurring in the city of Seattle very early. We were late to the testing, and so there's been a lot of catch up in testing. So we've seen a lot of people go through the testing. That's part of it. I think part of it also is just the cultural diversity within the communities that we serve, and the recognition of how the pandemic or how the virus is spread through close contact and through respiratory and getting masks in the hands of the people that need it and things like that. Beyond that, I mean, there's a million different contributing factors as to why that may be. What we're hopeful is that we will see that infection rate decrease as we continue to expand our testing capabilities. A lot of times when you stand up your testing site, the first 1,000 people through your testing site are the people that are sick, right, that have symptoms, and so they want to go get tested, and the only reason they haven't gotten tested is because they didn't have access to testing. And so now that they have access, the people that are symptomatic go get tested. And now what you're seeing is people that are not symptomatic getting tested because they were around somebody who was, and they're worried that they may have it. And so I think what you'll start seeing that number decrease over time.
Thank you for that. I know we have Representative Orwell with a question. You can unmute yourself, Representative.
Thank you. Thank you so much, Chief Morris. We're so grateful for your leadership during these stressful times. And yeah, we got hit hard by COVID, especially communities of color. And, we were supposed to have some early testing sites and none of them materialized. So just thank you. Thank you so much for your leadership to make that happen. I'm a huge fan of FD Cares. I think that is just an outstanding model. I don't know how much you're aware, there's going to be a 988 line that's going to be equivalent to 911 for behavioral health crisis that we'll be implementing in the next year and a half. And I just really want to hear, like, what can we do to kind of strengthen your model, especially as we expand behavioral health emergency services? It seems like you're such a perfect partner in this.
Sure. No, I think that's, well, first of all, I love the fact, congratulations to you, by the way, as well. And so I think that the 988 is a fantastic solution to that, right? Is to provide people another answer. And so what we face is that people find themselves in a situation where they don't know how to fix it for themselves anymore, whatever that may be. And they don't know what the next step is and how to move forward. And so what do? They call for help, and typically the only number they know to call is 911. And we are the right answer for that because that's what we're here for. And so we're focused on trying to create the right answer to the problem. And I think as we move forward, it's a partnership between law enforcement, it's a partnership between the fire department and then King County Public Health and social services and the nonprofits and all of those things that exist. For us, what we've discovered is that community health network approach where we're connecting hospitals to homeless shelters, to quick cares, to the different services. And then our cares team becomes a referral service, if you will, right? And so we'll go out and visit with somebody in their home. The nurse will sit with somebody for an hour, 2 hours, whatever it takes, and work our way through the questioning and determine what's the right answer. And then we start making phone calls and we start referring people to where they need to go. I think that partnering with police departments is a great way to do that as well. The police department provides us a lot of support, and vice versa, especially when we're working through our homeless challenges, right? The homeless population is difficult solutions to find. but I think as we move forward, I believe that the right answer in all of this is the right answer is going to be 1,000 different answers, right? There's no
Right,
one.
and a lot of partnerships, absolutely. Yeah, but we really want to build on the model you've done because it's so amazing.
I appreciate that. I think the key to it is the social worker aspect, right? Is that perspective. I think the key to it is to have the medical perspective of somebody like a nurse or a nurse practitioner or something on that level that has the bigger health system, as part of their view. And then we provide the emergency first response in the event that is a true emergency. And so we kind of cover all of our bases that way. So
yeah, that's great. Thank you.
Absolutely.
Thank you. So we do have another question, and I think, as the business community, this is really important. You said something that we are all concerned about having employees out in the elements and then coming back into the workspace. But you obviously have seen some success behind that. So this question is, number one, how often do your firefighters get tested? And to what do you attribute your department's zero infection rate success? And can you give any, advice to business owners to maybe model that?
Sure. So first of all, the zero infection rate is as a result of their duties and as first responders. We've not had anybody be infected as a result of providing care to the community. We've had people test positive, right? Just like everybody else has. And fortunately, we haven't had anybody get very sick. We've had a few people get symptomatic, but nobody's had any really life-threatening illness as a result of that. The Washington State Department of Health, King County Public Health have been very good about creating some guidelines that are in existence, especially the mask policy. So for us, and I think all agencies, and first responders, fire departments, is we have a mask policy. You will wear a mask, period, at all times. And the only time you're not wearing a mask is if you're alone in a room or if you're eating, right? Just no different. And that includes, you'll see fire engines driving around with the people sitting in the fire engine driving around, they'll all be wearing masks. And if you work in the support side of the organization and you work in an area where you're going to be interacting with people, you'll be wearing a mask. And so the masks are proven PPE. They're proved to reduce the potential risk of the virus. We have shut down all of our meetings. We meet virtually, right? I mean, just like this with everybody. In February, I'm not sure I knew how to do a virtual meeting, right? And so here we are less than a year later, and that's all we do. We limit our interactions to less than 5 people. One of the challenges we face is how do we continue to train our folks? A big part of obviously being excellence in fire service is being good at what you do, which means you have to practice. And training is difficult because typically we will bring 20 and 30 people together for a training class in the region. And how do we do that and prevent cross-contamination or risk of the virus? I think the key to the whole program for businesses especially is it's all about masks, it's all about hand washing, it's all about time, distance, and shielding. Right? If you have to interact with people, keep it less than 10 minutes. Don't put people in a room together, close quarters. If you are, wear a mask. Do as much stuff virtually or telecommuting as you can until we can get to the other side of this thing where we start seeing the vaccines become available. One thing I will say that's been very encouraging is the fact that the medical system, our medical care related to COVID has improved so much, and they're so much better today than they were in the first days of how to treat the disease. I think, the medical community has done an amazing job of just learning on how to treat COVID and how to prevent it from becoming life-threatening. And so we're seeing fewer hospitalizations, a decreasing, level of impact in the healthcare system. So.
Great. Now, when you're talking about masks, there's a question here in the chat. Are you talking regular face masks? Is there some special? I know at the very beginning, N95 was a buzzword and new to some people in the business community. So are regular face masks enough, or should they be wearing face shields or something different?
Sure. There's some great guidelines for that as well through the Department of Health and Washington Department of Health. And so we break it up by risk factor. And so if we qualify high, medium, and low risk. A high risk activity is providing EMS response, patient care to a known COVID person. And so that's an N95 mask. That's their highest level of protection, along with goggles and a gown and gloves. A moderate risk is more about prolonged exposure to an unknown risk, meaning we're going to be around somebody for a length of time. And so that will be a surgical level mask. And then for the regular, normal daily in passing of people, you're not going to be in a room for an hour or two together, then that's just the cloth mask, I think, that you see most people wearing, or there's just the real basic mask. And so if it's a low level risk, the low level mask is more than appropriate. But the key to it is absolutely a mask.
Thank you for that. And just so you know, Kent Chamber via Seattle Southside Chamber, Kirkland Chamber, we were able to secure some masks. And so we do have masks here on site at the chamber. So if you're in need of free mask, we may have some hand sanitizer. I'll have to check with Araya, but I do know we have both the cloth mask and the disposable masks that are free to you as chamber members. So please reach out to us if you feel like you need something additional. So perfect. We've got a couple more questions here. And with the FD Cares program, how does that interact with cops? Because I don't think, yeah. How do you interact with the police department?
Well, obviously, if it's a response-related event, then we're interacting by just joint communication and through the crews on the scene interact. Our CARES program interacts with the law enforcement in a couple of ways. One, as part of the normal response, but they also have regular partnership and meetings and relationships that they talk and share information with each other. And they identify the risk areas in your communities, right? The homeless encampments or just the high risk areas that we're worried about some folks, and the lower income areas, or even it can be the convalescent centers where we're worried about the spread of COVID. And so those types of things, the CARES program interacts, the law enforcement, like Kent PD has a liaison, if you will, that we interact with and meet with and share information with. And so we try to partner with all of that. And what we find is that when we identify a high risk area or a frequent utilizer of the 911 system, that we need to help get them to the right answer, that type of referral can come in from the police department. We'll call our CARES program. The fire department, whether it be our fire department or other fire departments, can reach out and contact our CARES program. It can come in from the EMS division from King County Public Health. And however that gets referred into our CARES program, then that social worker and nurse, they work with the referred patient to get to the right answer. So it's all about relationships, right? And so.
Yeah, that's great. So I just have a general question on that. So we're here in downtown Kent. Recently, we've seen an increase in homeless. And to be quite honest with you, it seems as though, from my limited experience with mental health, that there are folks that are experiencing active mental health issues in front of my eyes. What would a person or a business community person be able to do to get them to the right persons versus call if they do not want to call 911? What is the other option for them?
Like was mentioned, the 988 number, which is coming, will be the absolute right solution to that. Don't be afraid to call 911. The call taker and the dispatcher will filter or triage or prioritize that call. If you see a risk in your community, if you see somebody that you feel is at danger to themselves or others, please call 911. I mean, that's your answer today, and then allow us to kind of figure out what the right resources to send. And there's nothing wrong with call 911. There's nothing wrong with our initial response being a couple of firefighters on an aid unit, and then we start to dig in and determine what the real needs are, right? And if that's where we have to start, that's where we start. But if you're in your community and you see somebody that you are worried about for themselves or others, don't hesitate to call for help.
Thank you. I appreciate that.
Yeah, absolutely.
So I'm going to ask you this question, but again, because obviously the person asking this question believes that you are a trusted messenger for the community. So this may or may not be a difficult question to ask, but have you personally gone out to eat at a restaurant, and do you believe that it is safe?
I have not gone out much. I have a few times. I remember when we first came out of the quarantine. Do you remember, like, after everybody probably remembers when this was just a 2-week issue and we were going to flatten the curve, right? Mm-hmm. Yes, I went out after that. For me personally, no, I don't go out much. If I do, it's outdoor seating. The reason for that is because I'm very aware of the potential risk to my workforce and as well as to my family. My personal biggest concern with COVID is that you can have it and not know it, and share it and not knowingly share it. That's the greatest risk, right? And so it's all about minimizing your risk. And so have I gone out to eat? Yeah, absolutely. Will I again? Sure. Do I do it much less than I ever did before? Yeah, a lot less, right? And I miss it. I really do miss it. I think all of us are starting to really battle this, the new term, the COVID fatigue. We're sick of it, right? We're sick of the restrictions. We're exhausted by not being able to give people hugs or handshakes that we normally would. And I think it's hard on all of us, and it's exhausting. And the mental health of that for all of us, myself included, is a challenge, right? And I think as we kind of are hitting the crunch time of this, now's the time that we lean into it even more. The fall surge, this resurgence of COVID that we're seeing around the world is a result of that COVID fatigue, as well as the changing of the climate. And I think now's the time that we lean into it even more, right? And we wear masks more, and we be more careful about the people that, if we're going to be around people that we don't normally around, then we keep some distance from them, or we wear masks. And that'll get us through to next year. And then we will emerge from this. The vaccines will reduce the transmission rates. There'll still be COVID, but I think it will get to where it's less concerning, right? And I think by the end of the summer into the fall of 21, I think we're in a completely different place than we are today. That's my personal opinion. I backed up by a lot of the reading I do, so.
Yeah, awesome. Well, thank you. So it doesn't look like we have any more questions, so we will move on. But Fire Chief Morris, I appreciate you. I appreciate your time today. I think this was a really great conversation. We have a lot of folks looking at this on Facebook. You really are setting an example for others, and especially the business community, and gave us some answers on some of the things that we can do to help flatten the curve or keep ourselves and our employees safe. So as always, we'll reach out to you if we need anything. I'm sure we have flyers and pamphlets and things like that related to the CARES, FD CARES initiative here at the Chamber. So if you need anything, definitely let us know, or any new information to share, we'd be welcome, or we'd be happy to do that. So thank you very much. Now I'm going to talk a little bit about the different events that we have going on with the Chamber. COVID-19 has slowed us down in respect to meeting in person, but that is no lack of workshops, whether it's online and also with some of our investors and our partners. So we have collaborated with the Covington Chamber. I wish we had it on this flyer, but the Covington Chamber and the Kent Chamber is doing our holiday ugly sweater party together. It's going to be virtual. We have some great boxes available for that holiday party. Today, we're going to be doing a raffle to give out some of the raffle tickets for the party, or you can purchase a box for the ugly sweater holiday party. And then that's going to be in December. So December 10th, that'll be our December luncheon. We also have one of our investors, Republic Services. They're going to be talking a lot about recycling. And for me personally, I'm married to a garbage man, but I still don't know how to recycle properly. So I am going to listen to this workshop. So if you have any questions about that, definitely join us for that workshop on November 17th. And then the Kent Chamber of Commerce is starting a DEI committee and the 1st of January. If you have an interest in joining our DEI committee, just reach out to us. But we have started a Black in Business Conversation series, and this is via a grant through King County, because they definitely see and understand that disproportionately the minority community business owners were heavily affected by COVID-19, as well as many other businesses, or all businesses, should I say. But we are going to be talking a little bit about minority businesses and the intersection of COVID-19. And so our next conversation is on the 13th of November. It's an evening event. Doesn't cost you anything to listen into the conversation or ask questions. We have a variety of folks on the line. We have business owners, and then we have service providers. And these service providers are talking about some of the services that they offer that helps businesses, not only minority businesses, but helps all businesses kind to advance during this time and make sure that they're set up if this does happen again, that they have the support that they need. And so this is series number 2 of our 3-part series for 2020, and then this will continue in 2021. The next slide, we have a few more events. We have the Kent Chamber of Commerce. So as you know, with COVID-19, a lot of folks are maybe looking to transition out of their current career. And so we have Discovery Northwest, which is a chamber member going to be presenting on career repurposing and transitioning. Again, free, it's a workshop, so you're able to join online. And then Boeing has asked, as a investor for the chamber, they have asked if we could create a space for them to give a chamber exclusive update from the Boeing company. And I would highly urge everyone to sign up for that. Boeing has obviously had some major changes in the last few months. And so I could imagine that that will be the same when they come and present to the chamber chamber community. So again, all of these events you can register online at kentchamber.com. And then here we have a new, not a new member, but a new person representing Puget Sound Energy. Puget Sound Energy has been a member with the chamber and a sponsor or investor of the chamber since 1967. And so we really appreciate them. They have a new community partner, new community advocate by the name of Heather Pierce. She's a wonderful person. So if your business needs a revamp of your services, then they will happily come out and do a service review of what you have and how you can save money. So that was just a little bit of information on our events, and yep, a little bit about our events. And then now we're going to go on to the trivia portion of this event. So first we'll do a commercial sponsor. So this is also something new. So we have a commercial sponsor, better known as the table sponsor, when we were meeting in person. And so this is, and we met her earlier today, Lily Tran with TaxUSign. She's an enrolled agent and founder of TaxUSign. TaxUSign is a virtual tax firm serving individual and small business clients across the U.S. They provide dedicated professional bookkeeping, taxes, and representation services anywhere and anytime. Her contact information is here, and she's also put that information into the chat box. So if you're in need of her services, definitely give her a call. We appreciate her for being our commercial sponsor for our November luncheon. And now we're going to go on to the raffle. And on this slide, Araya, every time you click, we're going to get a new question. So we'll just slowly click so that we don't give away all the questions. We are going to be giving away one raffle ticket to our holiday party. The way our holiday party works is if you join the holiday party, it's $20 for a box. We have multiple sponsors from businesses in Covington and also the chamber that have provided stuff to go into your box. I will give you one clue of what's in that box, because we're really trying to keep it a secret. But Red Canoe was able to provide a little cider and then also a glass for that cider to go into, so we can cheers to the upcoming new year. And then again, variety of other coupons and everything in the box. So in order, if you win a raffle ticket today, you can join and just wait for us to do different raffles that are available, or you can join as a box holder and also receive the box. But you must be present at the holiday party to win. So real quick on the raffle. So you'll answer this in the chat box, and we'll do just the first 2 folks that can get it into the chat box. And I will give you a second. Wonderful. All right, so click on that array and we'll go with the first question. I have my chat open. Who is the chamber collaborating with for our holiday party? Wonderful. Oh, it just says from, I don't know who. Oh, well, this is not working the way that I thought. Araya or Scott, can you see on your end the first 2 folks that pull that up? It just says from and then 2.
It looks like it's just Vine Maple Place. Oh, Sarah, sorry, Sarah and Vine Maple Place, and they both have the answer correct.
Awesome. So Vine Maple Place and Sarah with MSC. Wonderful. Thank you very much. Those are 2 wonderful chamber members that are nonprofit organizations that are always looking for folks to donate funds or items to help them with their mission and vision. So yes, we are collaborating with the Covington Chamber. Araya, if you have time, then if you can pull up the logo, I do just want to spotlight this logo that was made for the Kent Chamber and the Covington Chamber. It was actually, I'll go into it once Araya gets it. All right, so press play and we'll go to the next question. Oh, sorry, I told you to do something that really didn't help. So the next question is, who was our commercial presenter today? Awesome, Lily Tran. Yes, Lily Tran. Did we have another? Oh, I just gave the answer. Next person types it. We'll do the first two. And awesome. Perfect. So Araya is looking for that logo that we have. And Scott, can you see who that first person is that put in Lily Tran?
Yes, that's from Jennifer.
Jennifer, thank you. Jennifer Geller Law Firm. Wonderful. Now, so Jennifer with the Covington Chamber, she's a CEO there at Covington Chamber, and her and I and Araya were talking about this event. And we started to laugh because back, I don't know when, but the city of Kent and the city of Covington actually had a joke. It was on April Fool's Day. And they put in that the two cities were merging. And so they're doing this Kentington thing. So we thought, oh, that'd be a great spin since Covington and Kent, the Kent Chamber is hosting this event together. And so we told Araya's daughter, who I think she's very young, she's in junior high school, that we like to merge those two together. And this is what she came up with. And I just think it's fabulous. It has the K for the Kent Chamber, but it's in the color of the Covington Chamber. And they have this beautiful floral design going on the Covington Chamber. So we just thought it was really cute and exciting. So we appreciate little Miss Harley for getting that to us. She's a wonderful artist, and we appreciate her for supporting our chamber and donating her time to be able to get us that wonderful logo that we'll use throughout the year as we continue to partner with the Covington Chamber. Thank you, Araya. And then we'll go to the last question for the trivia. And again, we'll take the first two answers for this last question. Name two member businesses on the line today. Wonderful. We have TacuSign and Vine Maple Place. Wonderful, Jennifer. Thank you so much.
Tom also answered, so I got that. And Sarah also answered, so we'll throw in a ticket for Sarah too.
Thank you. All right, so we will go to the final slide, and it looks like hopefully I'll be able to give you a few minutes back in your day-to-day. So just wanted to recognize that all of the events that the Kent Chamber does is because of our membership and also because of our investors into the Chamber, folks that go above and beyond your typical membership to make sure that we're able to provide the resources and advocacy and events for you to hopefully thrive within your business. So again, thank you so much to Fire Chief Morris. This is our typical luncheon that we have, and so we appreciate him availing his time to be able to do that. We also want to say a special thank you to UMA, who was our sponsor for the day, and then also our commercial sponsor, TacuSign. If you have any questions on how you can become either the sponsor or a commercial sponsor, and you want to have that highlight at our next luncheon, be sure to reach out to me. But if you have any questions for the Chamber, we're happy to answer them. If not, enjoy the 15 minutes back into your day.